Um, I want to assess my patient's abdomen. Normally, I should be using an adult patient, but I will be pretending my 4-year-old son is my adult patient. So before I start this, I'm going to perform hand hygiene, and then um, I will gather my equipment. I already have my equipment with me. Sanitized it already, and then I'm going to introduce myself to my patient. Hello, my name is Tolu Adewuyi. I'll be your student nurse for today, and then I will verify my patient's name and do the two persons identification, check the wrist band to make sure the name and the date of birth is correct, and then I'll make sure he verbalize his name and date of birth to me as well. So after this, I'm going to provide privacy for my patient by drawing the curtain, and I'm going to explain the procedure to my patient. I will be checking your abdomen. My patient actually presented with abdominal pain, so I will be assessing his abdomen. So I have explained the position to my patient, but before I start the assessment of the abdomen, I'm going to ask my patient to check the quality of his pain by asking when the pain started, um, the onset of the pain, when did it start, like how often he has been feeling the pain, and then the factors that actually bring about the pain, what makes it better, what makes it worse. And then I'm going to actually ask how the pain is it dull, is it stabbing, or what is it like. And then I'm going to ask my patient to describe if the pain is localized to a particular area or it's spread to other part of the body. And then I'm going to actually ask my patient to rate his pain, the rate of 1 to 10. What is the intensity of the pain, how much is feeling the pain. And then I'm going to actually ask my patient when the pain first starts, like when he starts noticing the pain, and then what are those things that he was noticing at first, and like is he currently taking any medication for the pain. And then I will now assess his understanding. I will assess my patient's understanding of the pain as well. So because my patient actually presented with a pain, I want to ask him as well if he has any nausea and any vomiting. So if my patient is able to answer those questions, then I'll proceed to ask my patient about his appetite. Is there any change in appetite? Have you been eating well? So I'm going to ask my patient if he has been eating well, and my patient actually gave me an answer that there is a particular diet change in his food style for the past few weeks. He has not been taking lots of fiber, and he has not been taking lots of fluid as well. And then my patient actually said he has not been having the regular bowel movement, like the normal pattern. So normal pattern of my patient is to have regular bowel movement at least once in 2 days, but my patient have not had any bowel movement for more than 5 days. And then I'm going to ask my patient if he has had any past surgery and any colon cancer. The answer to all this is no. And then when I ask my patient if he has any reaction to any food, he actually said no as well. And he actually said he has not been smoking and drinking as well. To inspect the abdomen, checking the abdomen is flat, there's no distension, and then my patient is actually comfortably lying down and relaxed. He has a normal breathing. The normal breathing rate for adults is between 12 to 20 breaths per minute. My patient have the normal breathing. And then looking at the abdomen, the skin is smooth and even and then the color is the same with every other part of the skin. There's no scar. They're showing there's no recent surgery or wound, and there's no striae on the skin, and the skin color shows no jaundice, and there's no pallor as well. And then looking at the symmetry bilaterally, my patient, if I shine a light from one side to another side and then from the other side towards my direction, bilaterally my patient is symmetrically equal with the abdomen, and then the umbilicus is actually midline. The umbilicus is actually midline, it's not bulging out as well. And if I look at him swallowing, I cannot see any waves of peristaltic movement. And looking at his abdomen, there's no ascites, there's no mass, and there's no bulge as well. Looking at the four quadrants, if I want to check the four quadrants, I will be actually drawing an imaginary line vertically to divide the abdomen into two equal parts, vertically down, going down across the umbilicus, and then I will draw another imaginary line to go across the umbilicus horizontally from one side to another side to divide the abdomen into four equal parts. And then I will have the right upper quadrant, the left upper quadrant, and then the right lower quadrant and the left lower quadrant as well. So and then the regions of the abdomen is divided into three. We have the upper part as the epigastric, and the middle part as the oblique, and then the lower part as the hypogastric, So to auscultate, to listen to the bowel sounds, I'm going to start from the right lower quadrant using the stethoscope. I'm going to start from the right lower quadrant. I'll place my stethoscope on the right lower quadrant, and this is because the bowel sound is more it is louder on the left lower quadrant. And then I'm going to listen clockwise. I put it down on the right upper quadrant, and then the left upper quadrant, and the left lower quadrant. So if the bowel sound is normal, if it is hyperactive, it's going to have a loud high pitch, and this means there may be like an obstruction. There may be like an obstruction in the there may be obstruction in the intestine. And if it is hypo, or there is no bowel sound at all, this may mean there is a recent surgery that my patients have gone through, or there is actually an inflammation of the peritoneum. But right now the bowel sound is actually normal. And if there is no bowel sound, if I feel there is no bowel sound, I can actually listen again for like 5 minutes to make sure I want to really be sure there is bowel sound or not. And actually to try percussing my patient, I'm going to start again from the right lower quadrant and do that clockwise. And the reason is I'm going to start from the right lower quadrant and do that clockwise by putting my palm on my patient's abdomen and trying to tap. So I have to start close to the umbilicus, tap and listen to the sound. Okay, so I have to follow the clockwise motion and percuss clockwise around, and then after percussing, I want to be sure the sound is normal, which is a tympanic sound, and then actually um, to palpate. I want my patient complain of pain in the lower quadrant of the abdomen, so I want to start palpating from the upper quadrant and stop at the lower quadrant, since that was where the pain is. So I'm going to palpate about 1 centimeter deep, gently. I want to palpate about 1 centimeter deep, still in a clockwise motion. So while palpating, I want to be sure of the skin temperature. I want to be sure the skin is not too damp. I want to be sure of any tenderness or pain. You complain of pain on the lower quadrants of the abdomen. I want to be sure of any swelling. There's no swelling, there's no bulging, and there's no scar on the skin, and the temperature is okay. It is not there's no eye temp, it's not warm to touch, and then the skin is not moist. So I want to be sure of all this when I'm palpating the skin, when I'm palpating the abdomen. And I want to make sure to actually palpate the lower quadrant where the pain is last. After palpation, I'm going to tell my patient about my findings. Okay, so with assessing your abdomen, your abdomen is okay. There's no distension, there's no bulging, and there's no swelling, and your skin is good, and that is fine. So I'm done with assessing your abdomen, and I want to actually have a nursing diagnosis for my patient, which is a risk for constipation related to diet change. And I'm having this nursing diagnosis because my patient actually verbalized that he has not been having fiber as usual for few weeks, and he has been having less fluid intake for few weeks, and he has not had any poop for the past 5 days or more. And this compared to the subjective data he has before. So I want to look at that as a risk for constipation related to dietary change. After assessing my patient, I'm going to perform hand hygiene and document my findings. Then I will lower the bed, have my patient to dress up, and then make him comfortable. Thank you.